Hello, Dr. Tom McCall here. Most parents know that when their kid gets an ear infection, that usually it's a head cold that leads to it. Have you ever wondered why? This is how it works. Your middle ear is located behind the eardrum and is a bony cavity with air in it. The pressure in the middle ear is the same as the air pressure around us because the eustachian tube connects the middle ear to our oral cavity. However, the eustachian tubes are lined by the same mucous membranes that line our inner nose. So when you get a cold, the thick mucus and swelling the virus creates occurs in the eustachian tubes as well. The result is that the air pressure cannot equalize, and a vacuum is created in the middle ear. The vacuum draws fluid from the surrounding tissues into the middle ear, and bacteria from our nasal areas contaminate the fluid and multiply, causing an infection. It is true that many ear infections spontaneously resolve, so it is not unreasonable to discuss with your doctor whether to use antibiotics, but maybe just stick with pain-relieving medicine for a few days. However, if the infection persists, or your child appears ill or has fever, your doctor may recommend antibiotics right off the bat. Knowing all of this, you might now understand how ear tubes work. Ear tubes are placed surgically in the eardrum to prevent ear infections. A common misconception, though, is that they're placed there to allow the infection to drain, when actually the ear tubes are so small their opening is only about 1/20th of an inch. That you'd have to place one 10 feet underwater before there'd be enough pressure for the water to pass through the tube's hole. The tube's purpose is to allow the air pressure to equalize between the outside air and the middle ear, since the eustachian tube is not able to accomplish its usual task. If the pressure is equalized, then the vacuum doesn't form, the fluid doesn't accumulate, and the bacteria don't fester. Let's hope we don't have to see your kid for ear infections. They certainly aren't any fun. Thanks for watching, and remember, as parents, we're not trying to make kids who like us, we're trying to make kids whom we like.